Utah medical professionals recently traveled with Help Us Give Smiles, or HUGS Foundation, to Hanoi, Vietnam to perform surgeries on children. Now, the surgery is fixing something called microtia, a deformity of the ear.
In some countries, that defect is seen as a disgrace to the family, especially if it happens to the firstborn son. Good for Utah's Jason Nguyen brings us the patient's point of view.
This one small ear has such a huge impact on a child's life. These families hope these doctors can make things better.
Length, width of scapha.
The doctors are all actually working together. You have the Vietnamese doctors, the American doctors, the surgeons, and the anesthesiologists, making sure that each patient is in the best possible situation before their surgeries.
She already understands. I'm just going to listen to her heart.
That's exactly what Utah anesthesiologist Tyler Yates is doing with a 10-year-old patient before surgery.
I told her, I have a 10-year-old daughter your age at home, and she understood. I showed her a picture and she was very excited. I drew a little picture and she wanted to draw a picture for me, and she drew a picture of our family, and she wrote in English, "Family love."
Love is what most of these children have missed most of their lives.
In a lot of these countries, children with disabilities are literally abandoned in garbage cans, infants abandoned in garbage cans to die.
Amy Gee is a psychologist who travels with HUGS. She studies the family's dynamic and social impact of microtia surgeries. She says a physical disability like microtia can lead to bullying or teasing. If it happens over a long period of time, the child can also become aggressive. That's why these parents would do just about anything for this surgery. But the deformity impacts more than just children.
You have to cut it. We will remove it.
Lin Von's face and chest were burned during a chemical explosion.
How many times? Usually 2.
Before his surgery, he sits with his wife one last time, remembering why he is here.
A chance to change my life.
When asked how his life would change, he gives the same answer as the younger patients.
I will feel confident to the social, and I will sociable.
Cece Krokenberger is one of the nurses in the recovery room. She's often one of the first faces the patients see post-surgery.
He was, half in, half out of it for a while, and then he kind of came to, and before he left, he stuck his hand out for me to shake his hand, and in English, he said, "Thank you, I love you."
The sincere emotion from these patients is an everlasting gift for every member of the HUGS Foundation. It's seen in the smiles and touches the heart.
Now, I watched and followed a lot of these children. Take this next girl. She's 18 years old. She's from a small suburb out of Hanoi. Now, she was heading into her second surgery and was able to comfort so many of these scared children who were going into their first surgeries. Her smile gave these children a peace of mind. Words can't explain just how life-changing this work really is.
All right, we know Utahns love to get involved with stuff. Jason, how can people help?
Well, they can go to goodforutah.com. We put a link right there for everybody. If you want to go on one of these HUGS missions, or if you want to get involved, 100% of all donations goes to these surgeries. So we made it easy for everybody. Just go to goodforutah.com, click the link right there underneath HUGS, and you can go and get involved.
Each story you've been telling has been great, been different. What about tomorrow? Because so far, 3 great stories.
They've been great, yeah.
I'm excited about tomorrow. Personally, tomorrow is about the life in Hanoi. So you'll get to see exactly what you can expect if you go to Vietnam. And I'll tell you, crossing the streets there, it's a hard thing to do.
Eating. I know you did that a lot.
There you go. Thank you, Jason.